Good afternoon and welcome once again to our weekly COVID-19 public health update with Montgomery County Executive Mark Elridge. I'm Lorna Vigili, Hispanic Public Information Officer, and joining us today is Dr. James Bridgers, who is the Acting Health Officer for the county, as well as Dr. Earl Stoddard, Assistant Chief Administrative Officer, and Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response for the Department of Health and Human Services. And also joining us today, it's Montgomery Recreation Director, Robin Riley. Thank you, everybody, for joining us. Reporters, you should have permission to record. If you do not, utilize the chat to let us know. And with that, Mr. County Executive, I toss it to you. Good afternoon.
Good afternoon, and I thank everybody for joining us again for our weekly briefing. I have no choice but to start this week's update by extending our heartfelt sympathy to the people in Uvalde, Texas, where we saw at least 19 children and 2 adults killed in a deadly attack at an elementary school on Tuesday. The gunman went to a school, unleashed a barrage on the students in that school. It's an unthinkable loss for any community, but as a human being and a parent and a former teacher, it is painful to think about the anguish of the parents and grandparents, the friends and the families must have felt while they were awaiting word about their child or their loved ones. We are all scarred by these incidents and will live with that unsettling feeling until real action is taken to take guns out of the hands of people ready to kill the innocent and alter their lives so mercilessly. This is the second week in a row that we're addressing a mass shooting in this nation. Earlier this week, we held a meeting and vigil with faith community leaders and following the targeted shooting of a grocery store in a Black community in Buffalo and a shooting of an Asian American church in Southern California. Our Black and faith communities remain concerned and worried about their neighborhoods and houses of worship that could easily be targeted by someone. The idea that our society allows an 18-year-old to walk into a gun store, buy weapons that are designed to be used against people with no background checks and no waiting period is insane. It remains absurd that it's more difficult to get a driver's license than it is to buy a gun. We know there are way too many guns on our streets and available for purchase outside of any regulations. But where we have the opportunity to regulate sales, and particularly to limit the sales of weapons designed solely for the purpose of killing people, we need to do it. The tragedy deeply impacts people in that community, but is impacting everyone around the country as well by undermining our sense of safety and security. And we are watching people questioning whether they can be safe anywhere. This has to stop. This is not a way for a civilized society to have to function. Closer to home, Montgomery County Police are making continuous checks on our schools with community engagement officers in the wake of the violence in Texas. Yesterday, we held a meeting about youth violence with myself, Council President Albornoz, Council Members Rice and Katz, Chief Jones, Dr. McKnight from the school system, and Dr. Crowell, along with many of our regional service center directors and key staff members. Chief Jones reported to us that 8 out of 14 homicide victims so far this year are under 21, and 11 of the suspects in 13 of our 14 homicides are 21 and under. Most of these incidents actually involve people who are not in school. This is not just a school issue, it's an issue for all of us. I'm glad the Council Member Rice convened this meeting, and I couldn't agree more with the consensus of all the entities involved that we need to come together and work on this problem now before it gets worse. In the current year's budget, I left money unallocated for the council to spend on urgent priorities like this as they emerged. I called them to direct some of these funds toward these efforts. We have a lot of employees and resources already working to prevent youth violence, and it is important to remember to remind the community of these numbers. And these people are there not just to prevent youth violence, they're to help youth with mental health issues, with disconnection issues, people feeling insecure and uncertain about where they fit in. It's more than violence, and violence often starts with other underlying issues. But this is the data on what we've got in place today. MCPS has 254 school security staff. They have 579 counselors, 146 psychologists, and 36 social workers. Plus our county HHS employs 140 school nurses and 240 health room techs. HHS also operates 14 school-based health centers with mental health services in a mix of 5 high schools and 9 elementary schools. And 29 linkages to learning programs are there to assist students and their families by connecting them to services and resources that address the social, economic, health, and emotional issues that may interfere with the student's success. And we have 6 street outreach network anti-gang programs in schools today. Furthermore, the FY23 budget will expand the wellness centers to 10 more high schools, focusing exclusively on mental health services this year. And an additional full-service health-based health center will open at Kennedy High School. We are all scarred by these incidents and will live with that unsettled feeling until real action is taken to keep guns out of the hands of people ready to kill the innocent and alter lives so mercilessly. We must have the will as a nation to say enough is enough to the gun lobby and the politicians they fund. And we must approach violence as a mental health issue and a national crisis that needs research and remedies, not just lip service. And we have to recognize it as a mental health issue. Most of us, anybody listening to us, knows that our normal recourse to a difference of opinion is not violence. It's not even hitting somebody is a minor act of violence. It is not violence at all. We have disagreements and we walk away from the disagreements. The fact that so many young people are resorting to violence to settle beefs is an indication that something has gone fundamentally wrong, and we need to figure out how we're going to address it and address it seriously. Next Monday is Memorial Day. It'll be the first time in 2 years we will celebrate this kind of remembrance with public events that acknowledge the people who made the ultimate sacrifice for our freedom. This month, Montgomery County Commission on Veterans Affairs compiled short biographies of the 22 men from our area that were lost during the global war on terror, from the Operation Iraqi Freedom through Operation Freedom Sentinel in Afghanistan. We solemnly remember those and pay tribute to the county's fallen who've given their lives to our country. I encourage all residents to visit the website and take a moment this weekend to acknowledge the reason for the holiday. Memorial Day is also the unofficial beginning of summer. So today we're joined by Montgomery County's Department of Recreation Director, Robin Riley, who is here to talk about county pools reopening on Memorial Day weekend and other upcoming events and the return of 4th of July holiday fireworks. This is the 3rd summer that the Rec Department has had to plan around and account for the impacts of COVID-19. Once again, they've risen to the challenge and are prepared to help everyone have a fun summer. We also want to thank Robin and her department for the amazing work that they've done to help in the fight against COVID. Our recreation centers were used as testing sites, vaccination sites, food distribution, and clothing distribution sites, and they were used to shelter our homeless populations. And Long Branch Community Recreation Center, along with the Cofield Recreation Center, these were locations that we provided for emergency shelter for the homeless during the pandemic. And while that happened, the communities lost the use of these centers. But it's important to note that being able to use these centers to shelter the homeless contributed to an astoundingly low number of deaths among the homeless population due to COVID. Now we've reopened the Long Branch Community Recreation Center. It has a fresh new look inside and out, and it's reopening to seniors and the public with new programs and services like sports clinics, cooking classes, and something called futsal. That's not a typo. If you don't know what futsal is, I invite you to check it out by heading to a Long Branch community calendar and finding out when you can drop in. Lives were saved because we had a place to offer help. I'm grateful to the Recreation Department and the people of the Long Branch community for this. I will now turn this over to Robin Riley for her comments, and then we'll take some questions before returning to our COVID briefing. Thank you.
Great. Thank you, Mark. I appreciate that. Yeah, we're excited about the Long Branch Community Center that's back open now. The center does have a whole new look, a lot of new furniture and exciting programs and services that are being delivered, including an awesome summer camp where we're going to be partnering to provide STEM and music and arts. We're working with Strathmore and others to really deliver a robust camp for both the Long Branch and Caulfield community. Most exciting is that our outdoor pools will be opening this weekend. We'll start just being on weekends until school opens back up, when school closes, I'm sorry, on June 18th. Our hours, we start at 11 a.m. on Saturday. We're encouraging everybody to go to visit our website at mocorec.com to check out not only the information about passes and admission, but also about safety rules. Putting your phone down, making sure you're watching your young person as they're at the pool. We're excited to offer a water safety day on June 4th, which will be at the Hector Ayala Pool. That will be from 5 to 7. It's a totally free event. We're offering all kinds of free safety information, introduction to non-traditional water sports, kayaking, and other things. So we hope you can come by to see that as well. We hope to see you at any of our 7 outdoor pools this weekend. We are fully staffed. We're excited about opening back up. So please stop by and see us if you can. The other opportunity that we have is on June 23rd, we're partnering across the nation with some of it's called the world's largest swim lesson. And we're partnering in that event. It's going to be at the Upper County Community Center, and that's on June 23rd. And it's for ages 4 to adult. Sessions start at 5 and 6:30. Again, entirely free. We want everybody to have a safe summer, and water and being with family is really important. So make sure you take advantage of all these safety opportunities. The other exciting news is fireworks is back. We're excited after a small break because of the pandemic to be able to offer 4th of July fireworks back to our community. We had a small hiccup with our contractor due to staffing shortages. They were not able to deliver the services. So our staff did an amazing job and did a pivot, and we're able to secure 2 new contractors. So we will be able to offer fireworks on July 2nd. And that will be at Wheaton at the Einstein High School with free shuttles coming from Westfield Mall. Great music starting at 6 with a Latin band, and then a rock band starting at 7, and fireworks at 9:15. And now you'll be able to go to Germantown also on July 4th and see fireworks there as well. They're great events for the family. You can come bring a picnic dinner. There'll be food trucks available, lots of great music, and then a great fireworks show. So we're hopeful that you can stop by at either our pools and or the fireworks, and we hope you have a safe summer. Thank you for the opportunity.
Thank you, Director Riley. We are going to open it now, members of the media, for Q&A regarding recreation topics with Director Riley and or the county executive, and then the other questions after the public health update. So do we have any rec questions from members of the media?
Can I jump in here? Steve Winnell, Bethesda
Hi,
Beat.
Steve Winnell. Hi, Steve, Bethesda Beat. Good afternoon.
Good afternoon. Director Riley, I'm sure given the events in Uvalde that you're wondering about what role your department can kind of play with programming and, offering young people services. I've seen stuff in the chat just now. Just what discussions are you having in this realm as this horrific news that's come out of Texas yesterday?
Yeah, I mean, that's a great question, Steve. This is emotional for all of our team. I mean, we work directly with youth in lots of programs. We have an elementary school, middle school, and a high school program. And it's rocked all of our staff and a lot of the families. And we're just encouraging our staff to have open conversations where they can with the young people and the parents to talk through how they're feeling and they're responding. I think this is a focus area for not just recreation, but also health and human services as we go through the summer to really make sure we're connecting and keeping youth engaged. Not only do we offer the opportunity to come to pools, but we have really robust after school programs that engage youth and talk to them about conflict resolution. We engage them in employment opportunities for our summer. I think it's an important time just to really keep open conversations and stay connected with a caring adult. And that's what our staff do a really amazing job at. We have high school rec zones where our staff really connect with young people every day, both at lunchtime and after school, and really good with connecting to other wraparound services and partnering with street outreach and health and human services. School system are truly partners, and we're having ongoing conversations every day to make sure kids stay connected with us.
Do you think, just leapfrogging right off that, all the programs you described, Are those bones, all the good bones, for lack of a better analogy, in place? Or are you looking even at other programs, like new programming, if that makes sense?
Yeah, I mean, I think this is a really good bone, a big, great structure to have in place. I think it's a good foundation for what we hope to grow out of the summer. We know that kids, as summer comes along and school breaks, that we need to stay engaged with them. So we try to do a lot of high adventure, a lot of sports programs, and keeping them connected to us. So we have a program called Soccer for Change, and that runs throughout the entire summer. And we're trying to stay connected with young people so that we don't lose that meaningful relationship that they have. And we hope to grow that as well. I mean, we were fortunate this year in the budget for FY23 to be able to add a couple new programs. And so we're super excited about adding 2 high school programs, one at Seneca Valley, and we hope the other one at maybe Muncaster Mill. We're still working through some of the school sites. But I think those are all important discussions, and I think that will add a really great wraparound service for young people.
Mr. Riley, thanks.
My pleasure.
Thank you, Steve. Any other questions for Director Riley from the members of the media? Yeah. Okay. Thank you, Director Riley, for joining us today. Mr. County Executive, you may continue now with a public health update.
Sure. So I'm going to give you our COVID-19 update now. As we approach the Memorial Day weekend, a lot of people are going to be traveling, which is why it's as important as ever to protect yourself, friends, and family as much as possible. We all know that it's possible to get COVID if you've been vaccinated, boosted, or had a previous case. But this is an opportunity to emphasize again how important it is to get vaccinated or boosted, because it helps protect you against the more severe cases of COVID. As you can see from the charts, we're looking at Montgomery County, Maryland, reporting 394 cases per, what is this? Cases per 100,000 residents, and the hospital admissions are at 7 per 100,000 residents. I want to talk about statewide case rates really quickly. Statewide case rates are now have exceeded the first wave, the second wave, the fourth wave, and the fifth wave. The case rates in the average new case rate now is in excess of 37 people. Oh, no, it's actually, yeah, it's in excess of, I think, 37 people. This is one of the higher numbers we've had. Our hospital admissions are up 7%. That's a percentage point increase from last week when we were at 6%. And on Monday, we saw the decrease in the 7-day case rate average for the first time in several weeks. And our community threat remains in the medium category. The 7-day average of new cases does exceed the highs of, as I said before, of 4 of the earlier waves. So this is, again, a problem we're concerned about. We've seen cases decline in New York and New Jersey. Their case counts, which rose sooner than ours did, have begun to level out off, which is a very good sign. We're hopeful that we'll begin seeing this as well. We are experiencing a much lower rate of hospitalization and acute bed usage despite the moderate transmission rate. So again, that's indicative of people getting sick, but not sick enough to wind up in a hospital. It's evidence that our high vaccination rates are actually paying off, and that 87.7% of this county is fully vaccinated currently. It's about 10% percentage points higher than the national average, but only about 55% of our residents are fully vaccinated, meaning they've received their first booster dose. And it's about 9% higher than the national average, but it's a problem because you, as we've mentioned earlier, you will see declining efficacy of the boosters without getting the additional boosters. So it's essential that you do this. Again, I'll remind people, for all the talk about this is like the flu, that's nice to say, except the flu has vaccines that are good once a year, and there is not yet a once a year vaccine for COVID. So while you may have already had 1 or 2 shots, you actually need the third and then ultimately the fourth shot if you're going to continue to have higher level protection. I'm like everybody else. I hope that we soon see a vaccine that is effective for a year, but we're not there yet. And until we are, please keep in mind that getting your vaccines updated is important. The federal regulators just signed off on Pfizer boosters for children 5 and up, and the county is preparing to be able to distribute them once they arrive, and we will share them with the community as we always have in the past. Also, we continue to recommend wearing a mask indoors as well as on public transportation. It's critically important if residents are going to be around family members who are unvaccinated, or friends who are unvaccinated, or immunocompromised, or the elderly. And it remains critical that if you feel ill or are exposed to someone to test positive, that you take a test. I'm now going to turn this over to Sean and Earl for their updates.
Thank you, Mr. County Executive. Just a brief update. You'll likely see when, of course, when you go to our county dashboard, the numbers, we've got today's numbers have just registered. It's now at 407 per 100,000. So it is continuing to creep up. We know we shared this with you last week. We just want to remind everyone of the guidance coming out from public health. Of course, emphasizing the importance of staying up to date with the COVID vaccines, wearing a well-fitting mask around others. Obviously, if you're symptomatic, have a positive test or an exposure, that's the 10-day masking guidance from the CDC that we also support. Further, if you're on public transportation, we ask that you please wear a mask. And just to protect other people in congregate areas, we're strongly recommending that now because of the high transmissions. Again, just we know that our residents are testing at high rates. A lot of them are rapid tests. Many people are going for PCR testing. Still recommending that people do that so that they can tell. Allergy season is also happening now. Don't take a chance. Please get a test if you're having any of those types of symptoms. And again, just to emphasize, there are therapeutics now. Those individuals who are at high risk for severe illness, they should definitely look into whether they qualify for the therapeutics. The best way is to talk with their healthcare provider. There's also some additional options that we have on our website for screening as well. Looking into where those cases are happening, we are seeing over the last 4 weeks, now we're now into about 8 weeks of this wave. Over the last 4 weeks, a little bit of a change in the age group, with the 5 to 17-year-olds having a little bit more of documented cases over the last 4 weeks. As far as distribution by race and ethnicity, we have not really seen much change in how this wave is occurring. Over the last 8 weeks, we have not seen much change. Again, with those hospitalizations, they are continuing to go up. And again, a lot of those patients are now at that alternate care site in Tacoma Park. It's doing a great job of helping to keep the capacities at the other hospitals not only lower with COVID patients, but helping them have more limited isolation protocols, more limited patients they need to do isolation protocols with in those facilities. We're continuing to track it though, as those rates go up. Again, when we're looking at death rates, we're talking about now where the transmission rates with PCR testing we're in that 400 per 100,000. Remind folks that back in December and January, early January, the county peaked at more than 2,200 cases per 100,000 during that first Omicron spike. Of course, the numbers we're looking at here with PCR testing are likely much higher, we realize, because of the rapid tests, which aren't reported. Even so, even without those reporting, of course, hospitalizations and deaths are giving us a picture of this more serious illness. And you can see it's much, much lower rates than what we saw back in December and January. If you look on the left, you can see, we are seeing those as we see those hospitalizations rates go up. Again, it's concerning that that the case rate for unvaccinated populations is much higher than for the fully vaccinated populations. I know probably nobody on this call is surprised at this. It's still just concerning because we have a very low number of unvaccinated individuals in our county, but we still wish that they would come out and get vaccinated because they are making up a disproportionate amount of the hospitalizations. Just an update from the variant typing, again, within another week of data, and the projections are that the BA.2.12 variant continues to become a larger and larger proportion of cases across our region. We see something similar in the New York, New Jersey area where it's a higher rate. And that may be, again, why those transmissions have occurred a little bit more quickly in those areas. As we looked at the data that's come out, again, it does appear that there is some leveling off in the New York, New Jersey area, some of the other New England areas. We are hoping that continues to level and in fact decline soon, and that could be a good indicator for what we might be experiencing in our area. Again, as you can look across the different regions of the U.S. Through the New York Times site, and you can see in the Northeast much higher case rates. It's very likely also those are places with higher testing capacity and testing rates, and again, just identifying more cases as a result. Looking globally, again, the US and other parts of the Americas continue to have some increases over last week. The US is, I think, about 13% increase from the previous week. Much of South America and Central America showing much higher increases, again, as this wave continues to go throughout this area. Much of the rest of the globe is seeing decreases. However, there are some increases in the Western Pacific and in Africa, as you can see here. With our vaccination rates, the piece of news I think most of you have already heard, as of last Friday, we received authorization from the CDC and from Maryland Department of Health to begin doing booster doses for children 5 to 11. Any child in that age range can get boosted after 5 months of their second dose. If they're moderately or severely immunocompromised, that window shrinks down to 3 months, consistent with other age groups. Again, our federal partners who have looked at the data have reminded folks that all ages are experiencing a waning of immunity after their initial vaccination. So that's why they're recommending boosters now for all ages. We're just looking at our reports back from December, which would be 5 months ago. And from that report, at this point, our county should have about 30,000 5 to 11-year-olds who were fully vaccinated 5 months ago. So we have started to see increased turnout. We've asked for more vaccine from the state, and we look forward to offering these booster doses to more and more kids. Again, just tracking across additional doses by race and age, we have seen lower levels of boosters as the ages go down. We're encouraged that currently of those 50 and older, or 50 to 64, 72% of those populations are boosted with at least one dose. And of the 65 plus, it's 80%. Of course, this whole age range is eligible for a second booster dose now. And, the primary vaccinations at those age ranges are in the high 90 percentiles. So again, those are the groups who are at significant additional risk versus younger populations. And we strongly encourage everyone to come out and get a booster dose. Just to share with you what we're seeing at our county clinics, we had seen increases of testing at our clinics by 20% each of the previous 2 weeks. We've leveled off a little bit over the last week. Of note, the positivity rate at the county clinics is around 20% right now. So lots of folks who are coming in are getting positive tests. It's a good support for if you are feeling symptomatic, please get tested because there is a good chance it could be part of this COVID wave. One other thing we wanted to mention is, again, Director Riley has been a wonderful partner, not only her, but the rest of the staff at the rec department. They were extremely supportive, not only in welcoming us into the rec department to do vaccinations and do testing early on and throughout this response. Their staff helped support bringing people in through efficiently and safely, answering questions. They're now helping us distribute rapid test kits as the libraries are. And we do have some signs up because we have both those drop-off PCR tests and the rapid tests available at those sites. So we have some information to help people understand which test might be better in which situation. So we're happy to share that with all of you just to help people make decisions about which test makes more sense. And then just finally, this is not a COVID related thing. I know there's been a lot of attention to the infant formula shortage. I know there's a lot of work going on nationally, as well as within Maryland and within Montgomery County to try to identify and connect people to the formulas. Just want to remind folks that anybody who's in the Women, Infants, and Children program can contact that program to find out more information and if they need support in trying to find formula. And for individuals who aren't in the program but think they might qualify, please contact them and see if you do qualify. More generically, if you're not in that program, we're recommending that parents who are struggling to find infant formula contact their healthcare provider. They may help them to either understand if a substitute formula would work or if they need a very specific support, where to find that. And again, we're just reminding people, please don't water down or dilute your formula. Please don't go online and look up homemade formula recipes. These both can lead to under nutrition for really vulnerable age individuals. And we certainly don't want to see that. In fact, it can even be life-threatening. So please contact your healthcare provider for more information, particularly if you may be able to switch to a different formula. So again, those were just some key points we wanted to share with you all. Happy now to turn it over to Dr. Stoddard or Dr. Bridgers if they have any additional comments they'd like to share.
I have none, Mr. O'Donnell.
The only thing I wanted to highlight is that in the morbidity and mortality weekly report yesterday, the CDC released a new study looking at the implications for long COVID and sort of post-COVID recovered patients. And I would encourage members of the media who are interested to certainly go look at their report. It's written in a way that I think is pretty understandable. But the key takeaway is that this comes from the report. COVID-19 survivors have twice the risk for developing pulmonary embolism or respiratory conditions. 1 in 5 COVID-19 survivors 18 to 64, and 1 in 4 survivors age 65 and older experience at least one incident condition that might be attributable to previous COVID-19. So this is this work on long COVID and the implications for post-COVID infection is still ongoing. I would not draw any strong conclusions from necessarily what's being printed here, but there's a lot of work being done currently by the federal government and research institutions across this country to understand what the implications of long COVID and COVID infection are in the long term. And, obviously, whenever we see these new publications, we like to point them out because we know that as part of our recovery from COVID-19, we'll have to be able to understand and manage the long-term implications of COVID-19 infection in our population. So I will stop there and I think turn it back over to you, Lorna.
Thank you, gentlemen. Let's get started with the Q&A portion of the presentation. I believe Fox 5 News has some questions for the county executive. Please identify who you are and welcome. Good afternoon.
Thank you. Yes, it's Stephanie Ramirez. Good afternoon, everybody.
Hi, Stephanie. Good afternoon.
Thank you. County Executive, this question is for you. And this is unfortunately, given the terrible shooting, the mass shooting that happened in Texas, there are real concerns that we've heard from Montgomery County Public School parents, even as recent as today, on the topic of police in schools. I want to ask you specifically because you did remove the SROs from the school buildings earlier in the year. We've heard you and county council members talk about how having an officer in a school won't stop a specific incident, say a shooter. But after some serious events in the county, for example, the shooting at Magruder High School, the response was to increase police presence. And now after what happened in Texas, we see police with community engagement officers now continuously visiting the school. So the question is, does the police presence at the schools help or does it not? What is your direct message to the community right now? And what is the plan to increase safety given the violence we've seen among youth in the county this school year especially?
So are you aware that the person who did the shooting in Texas was in a firefight with 2 police officers before he got into the school? And because he had body-worn armor,
yes.
They were not
County
able
executive,
to stop him?
Thank you for raising that point. We are aware of that. But again, it goes back to the response, which is increasing police security in the schools or having the CEOs continuously visit the schools. Why is the response to increase police, but then the argument from county leaders is that police in schools doesn't help? What is working here and what is not?
Well, there's no evidence that having officers in schools necessarily deters or prevents gun violence. I mean, that's just a fact. And there have been gun violence incidents in schools where there were officers there. So this is not a panacea for the problem. We made a decision to put officers back in schools because the earlier decision that we in the school system and the council had made jointly was that we were going to use a model that kept police close to the schools and able to respond, but not necessarily inside the schools, and that our response was going to be to focus on, because this is primarily a mental health issue at the underlying cause of it, that we were going to increase the number of mental health workers in the schools. Because of the circumstances right now, as you know, the school system was not able to hire what they expected to hire. We never had the opportunity to see whether this model would be effective or not. And the school system asked, and I agreed, that given the uptick in things right now, that we would allow officers in the school, but on a very restricted basis, meaning they were not allowed to any longer enforce school discipline, which the previous agreement with the police had said they couldn't do. And yet that was the police, their primary activity in the school was enforcing school discipline. So we changed it. We made an acknowledgement that we did not have an easily available remedy to back up the inability to hire the people that we had sought to hire. And that's what we did. And we're asking our police to pay special attention to schools right now because people are worried about copycat incidents. Where somebody here might say, well, so-and-so, this happened there, and we all know that copycat incidents are an issue, where somebody, decides they want to do what somebody else did. So I think they're doing the right thing. It doesn't bother me that they're checking in schools. I'm glad they're paying more attention to schools under the circumstances. So I think they're responding appropriately. I think they responded appropriately to the inability to hire social workers when we thought we'd be able to hire them. And I'm okay with where we are this minute with this, but I will note again that we had a meeting yesterday with all of the key stakeholders in this, everybody who's involved in programming and in looking at what we can do to make our schools safer. And we are going to further develop programs to deal with the real underlying problem that these kids are dealing with. And by the way, they're not all kids. Montgomery County, and as I tried to point out earlier, most of our incidents involve people who are not in school, who are older than school age. So the schools are not the only source of the problem, and we need to deal with this broadly because public safety and issues have, led people to feel more insecure broadly. And that's how we're going to go after this.
I also have something I want to add to this too. obviously, based on preliminary reporting, and this is always subject to further reporting and further investigative details. Take the incident in Texas. Let's just talk a little bit through it. This is an 18-year-old individual who had been, had gone to school in the area, high school there, and I believe had gone to elementary school. Who I know some of the early reporting has he had a speech impediment that was a source of great bullying coming up. Then obviously that had impacted his socialization moving forward and his mental health moving forward. And then obviously on May 17th and May 20th, he purchased 2 long guns after turning 18 years old and purchased 375 rounds of ammunition on May 18th. And so I think that the point I'd raised in some of these is there were many opportunities to intervene in this incident long before that individual took those guns to that school to do what he did yesterday. And I think that one of the big things and the reason why we talked about this in the lead-in is everyone focuses on the question of the SRO, but the reality is, and I think law enforcement would tell you this, the best time to intervene in this young person's life was when they were being bullied in elementary school, or when they were facing the mental health challenges that occurred later on in the middle school or the high school, or perhaps at the time when they went to purchase these firearms. And so while we can make investments in things like law enforcement, and there is a role for law enforcement in this, at that point, if it gets to that point, you've already failed those students. The intervention really is mental health, social work, getting people the help that they need before these incidents arise. Because as illustrated in Texas, cops with standard firearms were insufficient in neutralizing this individual prior to their being able to access the schools. And so again, police officers have a role in connecting with school security and working with administrators as we allow them to do, to try and plan out how we can respond to incidents. But to suggest that they are the most important part of the solution or the sole source of the solution would be totally misleading, just given, I view what happened in Texas as a perfect illustration as why they can't be the only or the biggest part of the solution.
And can you also speak to security? We are hearing from parents that they're concerned about the actual security in the building. I understand some schools, you have to give a license, you have to buzz in to get in, but then other schools, there's more free access. Is the county also working on improving physical security in the school buildings?
As far as I know, we haven't received a request for school about any improvements. I don't know which schools have more limited access than others. I've been in high schools where, you don't get in until without going through an office first. So I can't attest that that's normal in every school, but if the school system feels they need to expand that, they should expand that. And they've got lots of FEMA money with which to do it, or lots of ARPA money with which to do that.
And then one more question before I toss it, and I'll try to revisit with more if possible. But, there was that meeting yesterday and some folks are asking why closed. Can you talk more about what happened in the meeting and, how the public can truly understand what's going on there when they can see any kind of change and be able to hold officials accountable to what discussions come out of those meetings if it's not open?
I mean, the best way I'd describe it was a preliminary meeting to kind of talk about what information we needed and what other resources we needed to bring to bear so we can sit down and actually plan out concrete responses. Craig proposed this, I guess at very late in the process, and we've pulled this together very quickly just so we could have the involved parties sit down and get, we needed more data. We've asked for more data. We've asked for people to start making suggestions. So this was not a meeting where anybody had any illusion that out of the meeting we would arrive with a solution to the problem, but we are going to work toward a solution, or at least solutions that could help reduce people's anxiety, but also the actual insecurity that people are feeling.
I would also say there's no illusions about the fact that government can't own this solution in its entirety, meaning it needs to be a partnership between the community and all of the entities, whether it's the school system, the executive departments, the county council, the nonprofits, parents, educators. I mean, there's a big connection between a whole bunch of people in this space, all the way from, the earliest ages all the way through high school and beyond. And so there were no illusions in the meeting yesterday. I think actually Mr. Luis Cardona from our Street Outreach Network made very clear that the only time you see progress in this space is when the communities are actually engaged. And so yesterday's meeting, as county executive said, was a preliminary meeting aimed at getting some of the government partners on the same page and starting to develop a roadmap around who needed to be, helping to coordinate a move forward. But assuredly, there is no solution without engagement of the community and investment with and from the community. And so I wouldn't view the conversation yesterday as, it cannot preclude participation from many, many others moving forward.
Thank you, Stephanie. Up next, Steve Monell, Bethesda Beat. Good afternoon, Steve.
Afternoon again. I might have asked this before of the health officials, but it's just interesting to me looking at the dashboard, as we've kind of been in this mini wave, I'll call it, hospitalizations for COVID have ticked up. But if you look at specific things on the dashboard related to the overall hospital usage, it remains kind of the low utilization categories, both for just general population and ICU use. And I'm wondering if any of the health officials on the call have an idea of why that may be versus prior waves that we're not seeing. COVID has started to tick up just looking at the dashboards, but it appears that like the overall use so far, thankfully, we haven't seen that surge like prior waves. So I'm wondering why that might be. Have you any thoughts?
So Steve, great question. And looking at the data, I had some thoughts, and I'll just jump right in here because Mr. O'Donnell and Dr. Stoddard have done a lot of talking already. So I will just provide them with some relief this afternoon since I didn't give an update. So looking at the data, Mr. O'Donnell presented the dashboard, and we look at the metrics regarding the community levels. But when you think about the data for hospitalization and the percent of beds staff, keep in mind that half of those beds that are staff, which really presents a picture where we have a higher count percentage-wise, are really occupied by our acute care settings. And so those individuals come in, they get treated, and then they are returned to their respective personal private spaces. And so the county executive mentioned that we have a higher or one of the highest vaccination rates in the nation with population greater than 300,000 folks. We need to work on our booster rates, and we know that we're working very diligently regarding that. So we didn't see the increase in hospitalization and the burden on the healthcare that we saw in Omicron. The other point to note is that we're managing and responding to multiple subvariants that Mr. O'Donnell indicated regarding Omicron, which its transmissibility is probably the highest variant that we've seen with the coronavirus. And so we have aptly responded and increased our messaging, provided more rapid test kits, more PCR test kits, either through our physical spaces or in our remote kiosks. So we don't have those numbers as we may have seen in previous reporting or previous waves. We've also done a little deeper analysis and looking at the international trends and trying to project what we've seen, as Mr. O'Donnell indicated, internationally, and comparing them to national trends in the Northeast to kind of get projections. And we are right along those lines, as he indicated. So looking at a week or two before where we are. So we're taking all those things in consideration and looking at the dashboards and the numbers, and we're seeing that, but we're taking a larger picture. We test a lot of folks, and so we're able to get a lot of folks out of the community, isolate them, and we know that that will suppress the transmission. And so while case rates may seem high, we test a lot of folks. The test positivity rates are lower, or is the lowest in the state. So it's not a significant number of transmissions as we saw in with the Omicron spike. So those are some of the metrics that we're seeing and why we can project, and our dashboard looks the way it does. So on one, at a glance, it looks one particular way, medium, but we know that there are some variants. There could be high community transmission rates, such as the number of cases that we're seeing, lower positivity, but the bed uses and the hospitalization and the deaths we aren't seeing. So I'll leave room for others to add.
I would say two things to add. Well, I mean, not to add to, I think to complement what Dr. Bridgers has already said. This is the sixth, I've lost count, sixth different variant we've seen since the beginning.
Yes.
And I think that's largely why the hospitalization rate is a bit lower, meaning if BA 2.1, 2.1 had been the first virus that we saw all the way back in 2020, it would have been catastrophic. The transmission rate on this virus, and I think the naivety, the immune naivety that we would have had to this virus would have made it absolutely catastrophic. Now, for better or for worse, we've had a ton of infections in all of the previous 5 waves. We've had vaccinations, we've had boosters, we have treatments now that are increasingly available, the test to treat programs that have been stood up. And so I think for a combination of all those reasons, that's why you're seeing lower hospitalization and unfortunately lower death than previous waves. We are not immunologically as naive as we were in previous. Each subsequent variant will build upon the immunity of the population from previous waves. It's not ideal to do it this way, unfortunately, but it is the reality of the situation we find ourselves in, is that even for those of us who've been vaccinated and booster, we've also been infected to layer on top of that in many cases. And so it just adds up to more immune protection in the population with each prospective wave.
Going back to the original question, are we seeing right now, I don't know if you know this, less severe hospitalizations that aren't COVID, that are just the really bad flu cases or what have you, really bad? Are we seeing that, or is it pretty similar to prior waves?
So
You have the FEP report you can share.
Yeah, I would say that we don't have the full numerical data on it. A lot more of it's anecdotal. A lot more of it is as we look day to day and look at those hospitalization numbers change. They do change quite quickly in both directions. The census counts. Previous waves, they were not changing that quickly. People who were being hospitalized, it certainly appeared that they were being hospitalized for a longer period of time, and a higher percentage of them were transitioning from acute care to ICU care. We're seeing a very low number transition to ICU here, and seeing that the volatility of the numbers seems to indicate to me that these are shorter hospital stays. Again, it's probably a variety of those factors that were mentioned: the increased immunity from previous COVID infections, and increased immunity from vaccinations and boosters, and this wave may also be less severe, not causing some of the same respiratory situations that we saw with the very, very first few waves that really had huge impacts on folks. I'll share with you for just 1 second that when we say that, trying to make sure I pull up the right one. So I'm going to just share this page again where we can talk about Maryland here. This is again compared to the Omicron, or the pre-Omicron highest spike, last winter's spike. So these are all ratios. And you can see in Maryland, we're talking about 50% of the cases are identified now compared to that previous spike. Well, we know that number is actually much, much higher because these are PCR numbers. So it very well could be the same level as last winter or even significantly higher. What is not being hidden by the rapid tests are the hospitalizations and deaths. And you see that's about 24% of that previous wave, previous high wave, and only 6% of the deaths. And it's not just Maryland, it's a lot of different places to different degrees, they're having a lower ratio of hospitalizations and deaths. So it is a good indicator. You know, we know nationwide people have gotten vaccinated. Of course, Maryland represents a lot of different vaccination rates across the board, but Maryland is one of the more vaccinated states in the country. But certainly, you know, again, it goes back to, we're probably identifying more cases than a lot of places because of the high level of testing, but we're just seeing overall lower hospitalizations and deaths with this current wave.
Shifting gears, the last question I have is on vaccines and boosters. As you all are kind of encouraging people to come out for boosters, now that's available for 5 to 11-year-olds, is it better? I'm sure you want everyone, you know, across the board. If you haven't gotten your first or second shot, you haven't gotten your booster, you obviously want everyone to come out. But is there a better scenario if people get boosted, or is it better for people who you know, haven't even gotten their shots at all yet? You know, is that a better outcome for the healthcare system? Is there a better scenario between those two, if you follow what I'm asking?
I may not have caught the question correctly, but let me see if I'm on the right track here.
Just essentially, if people, is it better on the healthcare system capacity for people to come get boosted, or is it versus, you know, there's still a very small percentage of people in this community that haven't come at all to get their vaccine? Which is better in a nutshell, I guess, or is it neither or?
No, I mean, it's both should come out. We have the capacity to vaccinate both groups of people. It's not a capacity issue. The unvaccinated, the people who got 0 doses or 1 dose, they're still making up a disproportionate number of hospitalizations and deaths. They're ending up going at, I'll give you the rate in just 1 second, but they're going much higher rates. It is so the unvaccinated is becoming a case at twice the rate as vaccinated. So there are lots of breakthrough cases, but you're still at twice the risk if you're unvaccinated. And the as far as fatalities, it's 8 times as likely as those who are fully vaccinated. So yes, they're making up a disproportionate burden of people who end up in the hospitals and people who are dying. We would certainly want to see all those individuals become fully vaccinated. And then the next priority is those who are at greater risk need to get boosters. Obviously, everyone can and should get a booster. You know, I think all of us would want to limit, if we get infected, the significance of the illness, potentially limit the likelihood of long COVID. You know, we're still looking for data on that, but we certainly have the capacity to vaccinate both groups of people.
Steve, I'll give you a good analogy. I think with regard to boosters and vaccinations, it's a lot like if you're driving your car, right? And, you know, if you drive your car without your seatbelt on at high rates of speed, you know, maybe you get through fine, maybe you don't, maybe you end up car accident. And when you do get in that car accident, you're much more likely to be severely injured. Even if you wear your seatbelt, you have an airbag, you drive safe, all those things, that you can still get into an accident. You're just far less likely to have the worst outcome if you do, you know, if you do have that accident. That doesn't make your, you know, it doesn't mean you won't, you know, be injured or worse, but it just makes you far less likely. So I think the key here is the more layers you can put into your body and protect yourself, the less likely it is that you're going to get infected, and the less likely it is that you're going to have that infection result in a serious illness. And so we continue to encourage people to be vaccinated if they haven't, or boosted if they haven't, or, you know, adding boosters on when they become eligible, because it continues to further reduce your probability of that negative outcome. Just because you have someone get injured wearing a seatbelt doesn't mean that seatbelts aren't a good idea and a very important part of protecting you when you're driving your car. And we don't make that argument. And so that's why we require seatbelts. They aren't 100% going to guarantee you that you won't get injured, but the probability is so much greater that you'll be protected wearing a seatbelt than otherwise. The same thing is true with boosters and vaccinations.
Thank you, everyone.
Thank you, Steve. Next, Brian Sears, the Daily Record. Good afternoon, Brian.
Good afternoon, Lorna. Thanks for taking my question. I have one question and perhaps a follow-up. I wanted to ask if any of the health officials on the call could speak to why we're seeing higher community transmission at this point in time during the year. It used to be early in the pandemic, and I realize this is all kind of changing, that there was kind of an ebb and flow, and we expected as the months got warmer and we started to migrate outside, transmission would be lower. Moving back indoors meant higher transmission. But looking at today's state numbers, our rolling 7-day average is about 7 times higher than the same point in time a year ago. Just trying to get a sense of what we think might be happening here. And then as a follow-up, what does that mean in terms of us moving from pandemic to endemic?
So I just remind folks that the very, very first wave of this really didn't hit a peak until May of 2020. And while we've seen some of the biggest spikes around the traditional seasonal time for influenza and disease transmission, and a lot of that could have something to do with the gatherings over the holidays, over the Thanksgiving and Christmas holidays, and other winter holidays, and a lot of people being indoors. COVID has not just been limited to that. We had, of course, the Delta wave that began last August and then carried through much of the fall. And the initial one was, again, it kind of ran from March through, the peak was in May. So this is clearly, different from how influenza has mutated. And again, this is a coronavirus that is very novel to humans. And so each time it has a mutation, there isn't a huge subsection of all of us who had it 10 years ago, 20 years ago or so. So when these mutations happen, they are spreading at a more frequent pace than what we've seen with some other diseases that have been around a lot longer. So yes, with people being outdoors and doing more outdoor activity, there is maybe some less likelihood of transmission in those environments, but we don't live outside, we don't work outside, we don't go to school outside. So there is still transmissions that are clearly occurring indoors. And again, that's why we're recommending now during high transmissions, the wearing of masks when you're in those settings.
I would also say, Brian, the variant we were dealing with this time a year ago wasn't even Delta. It certainly wasn't Omicron, and it wasn't BA 2.12.1 variant of BA, which with each subsequent variant, the transmission rate, the transmissibility of the virus has increased substantially. And so you're correct in asserting that it's much higher than it was at this time last year, but the virus has evolved to be a much better, much more effective transmitter in human beings, number one. Number two, we've seen a significant shift in human behavior over the last year. We should be very honest about that. The frequency of mask wearing, the number of people willing to go out and be inside indoor dining settings, for example, is just very different at this time this year than it was a year ago. Candidly, absent some intervention, this is what we should generally expect to be happening pretty continuously every couple months. This is what living with COVID looks like. I don't mean to be glib about that. I just mean to say we should not expect anything other than what we're seeing if we are going to operate this way. And I think that there's a general consensus that people don't want to be as confined by COVID, and we're not seeing hospitalizations, which we've more greatly focused on. But infections, unfortunately, are going to come with this virus in for the foreseeable future. And I think that's just the reality. And if people want to avoid the infections, they're going to have to take some personal behaviors and mask and limit their indoor gathering space and all those things. Otherwise, this is what I think you should generally expect in our population.
Dr. Stoddard, that brings me back to my follow-up that I threw in at the end, which is, what does all of that mean then for us moving from a pandemic phase to an endemic phase, which I think we'd all like to eventually get to?
Right. So I think it's going to be a matter of, number one, we're going to build up more immunity over time as people get more infections and more boosters in them. And so in thinking about living with COVID, I think, when we talk about endemic, it's not really we make an active decision for the virus to be endemic. It's the virus just, the virus, it's basically a state of equilibrium. And equilibrium doesn't necessarily mean that you don't see infections. It's just, you probably see a lot of infections with a virus like this. It's just that, you know, it comes to the point where the immunity and the periodicity to infections becomes relatively constant, or not constant, like not a flat line, but it's, you know, predictable ebbs and flows. And so we're seeing that in, you know, the wave in the Northeast is slowly coming down, I think, and we're probably likely to follow. But in, you know, 2 months or 3 months, we probably have another wave come through. And I think that's just, this is what endemic COVID looks like if we manage it the way that we have nationally, globally chosen to manage it. And I think we've accepted this as the reality as a nation, as a human race, given the way that we're managing it.
Thank you, Brian. Up next, I believe Stephanie Ramirez has follow-up question for DHS officials regarding quarantine guidance. Stephanie?
Thank you. Yes, there was some concern from parents earlier about the quarantine guidance in school. So we wanted to follow up asking, if we already know that both vaccinated and non-vaccinated can contract COVID, why is the guidance, and I understand that this is CDC guidance, but why is it still accepted by the county that if a child in an elementary school setting identified where there's an outbreak is unvaccinated, but they're still not showing any symptoms or testing positive, why they are still being told they have to quarantine? Is there any, you know, plan to reevaluate this and possibly update guidance there?
So you're asking why an unvaccinated individual is being in an outbreak setting is being asked to quarantine. Well, one thing that, well, let me clarify this. Quarantine and isolation guidance from the CDC and consistently implemented and disseminated by Maryland Department of Health and by Montgomery County Health and Human Services has not changed over the last several months. Since it moved to 10 days with some more limited home isolation, more limited home quarantine, but still wearing masks for that 10-day period. That has not changed. It's not different in different settings. Within outbreaks, however, it does depend on the setting, how some other control measures are implemented in outbreak settings. It's a little different for assisted living and nursing homes than it is for schools or correctional facilities. But again, that guidance is if you are unvaccinated and you are exposed to someone with confirmed COVID, you should quarantine at home for 5 days. And then you can return and wear a mask for the next, you should test before you come back. It's not required, but you should test before you come back at day 5, and then you can come back day 6 and wear a mask for the remainder of the 10 days. That's the same in every setting. How we contact, trace, and identify those individuals, that piece has changed. As more and more people have this, it's very much moved to a policy in all settings where if you have a positive result from a rapid test or from another test, it's incumbent on you to let your close contacts know. That's largely how it's happened in the past, but with support of a universal contact tracing, helping to find and inform those contacts. We've now moved away from that universal contact tracing to something that, to more focused on high-risk individuals. But there is still guidance from the state about how schools and childcare settings should inform on a cohort level up until there's an outbreak, at which point public health then gets involved and does do more of that, that informing.
So there were a few elementary school parents whose children are unvaccinated, whose children they claim did not test positive, did not show any symptoms, but they were still told that they have to stay home for the 5 days. And some of them are claiming the children did not get any kind of instruction or anything like that. So to those parents, is there any look at the county health department changing that guidance, or is that essentially no, because it's still CDC guidance?
Yeah, that's the CDC isolation and quarantine guidance there. You know, we're really looking forward to the under 5-year-olds being eligible to be vaccinated. We'll hope it's sometime in mid-June that we can start doing that. And we certainly sympathize that this has been very difficult for parents of kids those ages who can't be vaccinated yet. Those who are older, we strongly encourage them to be vaccinated so they can avoid missing school for an exposure. You know, that's, you know, but again, the CDC guide, the county is not likely to change the CDC's guidance on quarantine and isolation.
I want to be very clear about this. This is only happening in an outbreak setting. We use the word outbreak often. That means that there is a belief that the virus is spreading in that classroom. I know we've talked about that vaccinated people can be infected. As a vaccinated and boosted person, I was infected. The probability of being infected if you are unvaccinated is substantially higher, as Sean was alluding to previously. About twice as many people, you're about twice as likely if you're unvaccinated to be infected. Not only are you twice as likely to be infected, but that means you're more likely to transmit and further propagate this outbreak in this setting. And so I don't mean to be dismissive about this, but if you're trying to intercede to prevent an outbreak in a school or a classroom or both, you have to take actions that you believe maximize the opportunity to stop the spread of that virus in that setting, to allow the school, the most number of students to continue safely in school and receive education. If in doing so, we have to quarantine parents children of parents who have chosen not to have them be vaccinated to minimize the risk that those students pose to their classmates, that's what public health is going to do and has done since the beginning of time to stop the spread of viruses in settings like this. And so to those parents, I would say, we are more than happy to sign your children up for a vaccination opportunity to make them be able to stay in school and reduce the risk being posed to their classmates in that setting. Other than that, until CDC changes those guidelines, I don't think it's a good idea for the county to be overruling the CDC and Maryland State Department of Health on these issues. I agree that we should be keeping healthy students in the classroom, but the biggest way that we do that is to have those healthy students be vaccinated.
All right, thank you very much, Stephanie. I do not see any more questions from members of the media. We're done for this afternoon. Thank you, everybody, for joining us. We'll see you
Thank you
again
all.
next week. Stay safe.